Garlic, the despised spice that becomes the most beloved remedy after 60. Dear friend, there's a spice many of us tend to avoid because of its strong smell, its sharp taste, and that lingering breath after a meal. Yes, we're talking about garlic. But did you know that the very thing you may have disliked for years is quietly working behind the scenes to protect your heart, clean your blood vessels, and help regulate your blood pressure? Garlic, small as it may be, is now recognized by modern scientists as the most powerful natural antibiotic found in a senior's kitchen. Just one tiny clove, when used correctly, can lower blood pressure without medication, reduce bad cholesterol, helping your blood flow more freely, prevent blood clots, a leading cause of stroke in older adults, and boost immunity, protecting you from colds and infections as the weather changes. The best part is, you don't need expensive pills. You don't have to look far. Just open your kitchen cabinet and you'll find a healing remedy that has been trusted for thousands of years. Of course, eating garlic regularly might make you a little less popular on group outings, especially among your retirement friends, because of the aroma. But remember, better to smell like garlic than to end up in the emergency room. So how do we eat garlic the right way? Enough to get the benefits without causing issues for the aging body. Let's explore that in today's video. And if you care about your health, or you're caring for a parent or grandparent, don't forget to subscribe to the Golden 60 Plus channel, where real, age-specific health wisdom is shared just for those of us over 60. Garlic in traditional medicine. Why it was once considered medicine, not just a spice. Garlic, one of the most humble items in any kitchen, actually has a glorious history in both ancient and modern medicine. In ancient Egypt, records show that more than 5,000 years ago, garlic was given daily to slaves who built the pyramids. Not for flavor, but to increase endurance, ward off disease, and help recover from exhaustion. They believed garlic strengthened the heart, a belief that modern science has since confirmed to be valid. In traditional Chinese medicine, garlic was known as da suan, spicy and warm in nature, and used for disinfecting the digestive tract, stimulating digestion and circulation, detoxifying and reducing inflammation, warming the spleen and stomach, and most notably, lowering blood pressure and protecting blood vessels. In India's Ayurvedic tradition, garlic was used as a vascular rejuvenation remedy, clearing energy channels, protecting the heart and lungs, and stabilizing blood pressure. Then, in the 20th century, when Western science started to analyze garlic under the microscope, a remarkable compound was discovered: allicin. This compound would go on to earn garlic great respect in both ancient and modern medicine, and is the key player in the next part of our video. You see, garlic isn't just a seasoning. In many traditional medical systems, it was considered the poor man's antibiotic, yet with healing power that rivals modern pharmaceuticals. And in the next section, we'll explore why garlic is known as a natural vasodilator, helping seniors stabilize their blood pressure without needing a prescription. Garlic and blood pressure. How allicin acts like a natural vasodilator. High blood pressure, often called the silent killer, is a constant concern for people over 60. There's no pain, no clear symptoms, but a stroke can hit without warning after something as simple as a tiring morning. This is why garlic, such a simple kitchen spice, is now viewed by many heart specialists as natural medicine that relaxes blood vessels and helps balance blood pressure. The secret lies in allicin, a powerful compound found only in crushed fresh garlic. When you chop, crush, or chew raw garlic, two components inside it, allin and allinas, come together to form allicin, a natural antibiotic with these key effects. 1. Blood vessel relaxation. Allicin gently widens the walls of your blood vessels, especially the tiny capillaries where older adults often have hidden blockages. As vessels widen, blood pressure drops, helping the heart work with less strain, often without needing medication. 2. Reducing vessel spasms. One hidden cause of blood pressure spikes in seniors is sudden blood vessel constriction triggered by stress, anxiety, or oxidative damage. Allicin acts like an antioxidant, calming the nervous system and preventing overconstriction, indirectly lowering blood pressure. 3. Improving circulation. When circulation is smooth, the heart doesn't have to pump as hard to get blood moving through the body. That's how garlic lightens the load on an aging heart. Real-world studies back this up. A meta-analysis of 12 clinical trials published in BMC Cardiovascular Disorders showed that daily garlic extract for 2 to 3 months reduced systolic blood pressure by 8 to 10 ml. mHg, similar to the effect of a low-dose blood pressure medication. And you don't need pills. Just one small crushed garlic clove, left out for 10 minutes and then eaten before your main meal, is enough to let allicin do its work. Of course, garlic isn't a replacement for medication. But for seniors who don't yet need prescriptions, or who are managing their pressure well, garlic can be a safe, long-term, and cost-effective support for heart health. Garlic and cholesterol. How it cleans arteries and reduces atherosclerosis risk after 60. Our blood vessels begin to resemble old pipes, gradually narrowing from inside due to tiny buildups. These deposits are primarily bad cholesterol, LDL, and oxidized fats that silently form plaque, narrowing the arteries and obstructing blood flow. As a result, blood pressure rises. The heart has to pump harder, and the risk of heart attack or stroke creeps closer every day. But garlic, just one small clove a day, can gently and naturally help clean the blood vessels. 1. Garlic helps reduce bad cholesterol, LDL. Allicin, the active compound in garlic, mildly inhibits an enzyme called HMG-CoA reductase, which the liver uses to make cholesterol. When this enzyme is suppressed, the liver produces less LDL, making your blood thinner and arteries clearer. 2. Garlic helps increase good cholesterol HDL. Garlic not only lowers LDL, but also encourages higher HDL levels. HDL acts like a cleaner. It carries excess LDL back to the liver for disposal. Simply put, garlic helps nourish the cleanup crew in your bloodstream. 3. Prevents oxidation of blood fats, the real trigger for artery clogging plaque. It's not just high LDL that's dangerous. Oxidized LDL is the real culprit behind inflamed arteries and plaque formation. Garlic, rich in natural antioxidants, protects cholesterol from damage, reducing your risk of atherosclerosis. Clinical research. A study published in the Journal of Nutrition showed that people who took aged garlic extract for 6 weeks reduced their LDL by 10 to 15% and increased their HDL by 5–8%, simply by adding garlic to their meals. And you don't need fancy supplements. Just add garlic to your daily cooking or crush a raw clove. Let it sit for 10 minutes to activate allicin and enjoy. Each small clove helps make your arteries a little cleaner, day by day. Garlic and immunity. Why seniors who eat garlic rarely catch a cold, dear friend. After age 60, our immune system often acts like traffic police on a hot afternoon. Tired, sluggish, and not eager to chase anything down. This explains why. Colds seem to arrive right on schedule. A slight breeze leads to sneezing, sore throat, and fatigue. But there's one humble food and doctor visit. No prescription that quietly helps wake up your immune defenses. Garlic. 1. Garlic is a natural bodyguard against colds and respiratory infections. Allicin doesn't just fight bacteria. It also inhibits common viruses that cause colds, seasonal flu, and throat infections. When eaten regularly, garlic builds a natural protective barrier, making it harder for viruses to invade your cells. A study in Advances in Therapy showed that people who took garlic supplements for 12 weeks caught 63% fewer colds than the placebo group. And if they did get sick, they recovered 1.5 times faster. Yes, one clove of garlic may outperform your entire cold remedy kit. 2. Garlic helps activate lazy immune cells. It stimulates the production of natural killer NK cells that destroy virus-infected cells, macrophages that engulf and clean up germs. Think of every clove of garlic as a gentle nudge to your immune troops. Wake up, the enemy's coming. If you want fewer sick days, less reliance on antibiotics, and fewer dry coughs each time the weather changes, try eating garlic daily. A small clove may be your body's most affordable and sustainable natural vaccine. And if you find this information helpful, if you believe that good health in our later years is worth investing in, don't forget to subscribe to the Golden 60 Plus channel. We're here to bring you simple, valuable tips just like this little clove of garlic. How much garlic is enough? Should you eat it? Raw, cooked, or aged? And when is the best time? Dear friend, garlic is powerful, but only when used in the right amount, at the right time, and in the right form. Not everyone can handle swallowing a raw clove in the morning, only to breathe fire for hours afterward. 1. How much is enough? Nutrition and heart experts recommend healthy adults 1 to 2 cloves of fresh garlic per day, around 4g total. Seniors or those with sensitivity, start with 1 clove daily and avoid taking it 365 days a year. Instead, use it in cycles 2 to 3 weeks on, then 1 week off. Too much garlic may cause stomach irritation, burping, and heartburn. Bleeding risk if taking blood thinners. A breath so strong it might earn you a separate seat at afternoon tea. 2. Raw, cooked, or aged, what's best? Raw garlic has the highest allicin content, the compound that promotes circulation, lowers blood fat, and fights bacteria. But only if it's crushed and left in the open air for 10 minutes before eating. Cooked garlic is easier to digest, but loses most of its medicinal allicin due to heat. Still beneficial for adding flavor, aiding digestion, and mildly lowering cholesterol. Black garlic, fermented, has a sweet taste, no odor, and is easier for seniors to tolerate. Research shows it still retains antioxidants and heart protective benefits, making it ideal for those who can't eat raw garlic. 3. When should you eat garlic? For raw garlic, eat in the morning or 15 to 30 minutes before a main meal. This allows better allicin absorption, supports digestion, and regulates blood pressure early in the day. For sensitive stomachs, eat after meals to reduce burning or bloating. Black garlic can be eaten anytime as a mild functional food. Quick tip: after eating raw garlic, chewing mint leaves or sipping warm ginger water can help neutralize the smell and ease digestion. With the right understanding, a tiny clove of garlic becomes one of the most affordable, natural, and effective medicines you can give your body without needing a prescription. Raw garlic, cooked garlic, black garlic. Which is the king? What's best for seniors? Dear friend, if garlic were a powerful family, it would surely have a little sibling rivalry between three unique members. And the eldest, raw garlic, bold, fiery, and strong-willed. The youngest, cooked garlic, gentle, easygoing, but a bit soft. The stylish cousin, black garlic, sweet, smooth, and surprisingly refined. So which one truly reigns as the king when it comes to protecting your health in old age? 1. Raw garlic, a warrior, but not for everyone. Pros: highest in allicin, strongest effects in lowering blood pressure, reducing inflammation, and killing harmful viruses and bacteria. Cheap, accessible, and always in your kitchen. Cons: hard to eat, pungent smell, can irritate the stomach. Not suitable for those with stomach issues, low blood pressure, or those taking blood thinners. Raw garlic is powerful, but not everyone can handle the truth. 2. Cooked garlic, gentle but less effective. Pros: easy to eat, gentle on digestion, suitable for seniors with sensitive stomachs, retains some antioxidant and digestive benefits. Heat destroys most of the allicin. Weaker effect on blood pressure and cholesterol. Cooked garlic is like a kind friend. Not very strong, but easy to live with. 3. Black garlic. Smooth and sweet, yet still potent. Pros: fermentation produces S-allylcysteine, a stable, highly absorbable antioxidant. No heat, no smell, tastes like wanty, great for seniors or those who can't handle raw garlic. Supports heart health, blood pressure, immunity, and even cancer prevention. Cons: more expensive. Not as widely available. Black garlic is the ideal choice if you want something gentle, safe, and won't drive your family away with the smell. So, what's best for older adults? If you're healthy with a strong stomach and want the full power, raw garlic. 1 clove day, crushed and left to sit 10 minutes before eating. If you prefer something easy on digestion, black garlic, 1-2 cloves day. If you just want a steady daily boost, use cooked garlic in meals. Remember, don't force yourself to eat something too spicy or harsh. Stick with what suits your body. Whichever garlic you choose, it can still be a precious remedy. When should you avoid garlic? Who needs to be careful or check with their doctor first? Dear friend, garlic is powerful, but it's not a cure-all for everyone. Some people feel energized with just 1 clove. Others end up in the clinic unexpectedly because of it. So, who should be cautious or even avoid garlic altogether? 1. People taking blood thinners, aspirin, or warfarin. Garlic naturally thins the blood. When combined with prescription anticoagulants, the effect can become too strong, increasing risks of internal bleeding, easy bruising, or difficulty clotting. If you take heart or blood pressure medications, consult your doctor before adding garlic regularly to your diet. 2. People with stomach ulcers or acid reflux, raw garlic is spicy and stimulating. It can irritate the stomach lining and worsen symptoms like acid reflux, bloating, or chest discomfort. If you've had indigestion, burning pain, or ulcers, avoid raw garlic. Opt for cooked or black garlic instead. 3. Those preparing for or recovering from surgery. Because garlic impacts blood clotting, you should stop eating it at least 7 days before any surgery. Even minor ones like dental work or eye procedures. 4. People with low blood pressure, garlic can lower blood pressure, which is great for those with hypertension. But if your pressure is already low, garlic might cause dizziness when standing, sudden fatigue, lightheadedness. 5. Those prone to allergies, skin rashes, or asthma, raw garlic may irritate sensitive individuals, especially the skin, eyes, or respiratory tract. If you notice itching, throat burning, rashes, or breathing issues after eating garlic, stop immediately. Not everyone's body agrees with garlic. In summary, garlic is medicine, but only when used wisely. If you're taking medication, have chronic health conditions, or aren't sure how your body reacts, talk to your doctor before making garlic a daily habit. And always remember, there's no one-size-fits-all superfood. Only what suits your body best. 1 clove a day. Small, but life-changing in old age. Sometimes in life it's the simplest things that turn out to be the most valuable. A warm glass of water in the morning, a peaceful nap at dusk, and a small clove of garlic resting quietly in your kitchen. Often overlooked, but holding the power to protect your aging body. Garlic isn't just a seasoning, it's a silent companion, helping you fight off high blood pressure, high cholesterol, infections, colds, and the plaque quietly building up in your arteries over the years. And the best part, you don't need a hospital to access it. No prescription, no doctor's note, just a little knowledge and a little consistency. 1 clove each morning, maybe a bit smelly, but possibly improving your blood circulation, keeping your heartbeat steady, and who knows, maybe keeping you off long prescriptions and hospital beds. And if someone teases you by saying, "You smell like garlic," you can smile and say, "Better to smell like garlic and be healthy than smell nice and end up in the ER." You deserve to live strong, independent, and sharp at 60, 70, even 90. And if you believe that true health comes from small, wise choices each day, join us at Golden 60 Plus, a place where we share real, down-to-earth advice truly made for seniors. Thank you for staying with us through this video. We'll see you again in the next journey, where every ingredient has a hidden power, waiting to help you live longer, live better, and live more lightly each day.